My name is Arshia Sandozi. I'm a general urologist here at Maimonides. I see a wide variety of patients, both men and women, who have some kind of urologic needs. I see everything from kidney stones to prostate cancer to pelvic organ prolapse and recurrent UTIs. One of my special areas of interest is in treating women, both in general urology, but also for their urogynecologic needs. In women, I can treat their needs from kidney stones and recurrent UTIs, but can also focus on their pelvic organ prolapse or overactive bladder symptoms. Urology treatments can be offered in a spectrum of care. We can work with you to make behavioral modifications that might impact your health, offer medications, do procedures in the office, and even surgery if you need it. Many patients come to me after they've had pain from kidney stones, but a urologist can help you with everything from prostate cancer screening, recurrent UTIs, trouble urinating, any infertility, especially on the male side, and trouble going to the bathroom. You might be wondering how urology fits into your general health care. Sometimes the urologist is the first line of contact for young men with erectile dysfunction who might have some kind of underlying cardiovascular disease, or people who have kidney stones who don't realize that they have hyperparathyroidism. One of the other things that we see is sometimes people will have recurrent UTIs and not realize that they have something underlying that needs to be corrected. Urology has always been on the forefront of minimally invasive care. A lot of the surgeries that we do can be done totally endoscopically, and we even use robotic-assisted surgery to help treat problems like prostate cancer, kidney cancer, and things of that sort. I grew up with doctors, and I saw how much satisfaction and joy they got from their work that really did inspire me to go into medicine. I got my medical degree from Des Moines University in Des Moines, Iowa, where I also received my master's in public health. After that, I completed my residency in urologic surgery at Maimonides. One of the best things about Maimonides is the neighborhood, the culture. Working in Brooklyn has its own set of unique circumstances and community that comes along with it. It was one of the things that drew me to Maimonides and one of the main reasons I decided to stay. Getting care at Maimonides is very special because you're being cared for by people who love the community and want to serve the people here as best as they can. Maimonides is a little bit of a hidden gem in the New York City hospital system, where you have this gigantic borough that's served by one large hospital, and you get the full spectrum of care and specialty services. There are a lot of amazing things that we can do in urology, and of particular interest to me are people who have trouble with voiding. So whether that's because you're not able to empty your bladder completely because you have a big prostate, or whether you find that you go too often, I can really work with you to develop a plan to fix those problems that you're having. One of the things I love about being a urologist and doing my job is that patients can come to me with very, very sensitive problems and receive help. I can speak to you about your erectile dysfunction, your recurrent UTIs, pain with sex, and we can work together to find a solution to problems that you may not be comfortable speaking with otherwise.